Hey there. I want to talk about something most doctors won't bring up at your routine checkup. And honestly, it's a bit awkward, but it's important. If you've stopped masturbating in your later years, your body might already be quietly breaking down, and you probably don't even realize it. No, this isn't some locker room talk or internet rumor. This is real clinical physiological truth. Ignoring it can affect your sexual health, your brain, your heart, your sleep, your immune system, even how you feel about yourself. I'm Dr. Joslyn, a urologist and men's health specialist with 5 years of experience helping older adults understand how their bodies change. Today, I'm going to walk you through what happens when masturbation disappears from your life. And trust me, it may completely change how you look at your health. Before we dive in, do me a favor. Hit that like button, comment below where you're watching from, and subscribe so you never miss tips that help you stay sharp, independent, and healthy as you age. Here's something you might not expect. Masturbation isn't just a leftover impulse from your youth. It's actually one of the most powerful ways your aging body can maintain hormone balance, protect your prostate, boost your brain, and even fight depression. And if you've stopped or never really kept it up, the cost could be higher than you think. In the next few minutes, I'll show you exactly what happens inside your body when sexual self-care stops, and what you can do about it. In my practice, I've seen it time and time again. Older men come in fit, active, proud, but quietly, they've abandoned a simple, natural habit. And the consequences? They're surprisingly serious. Masturbation isn't just about pleasure. It's about function. Function of your prostate, your brain, your pelvic floor, your hormones, your sleep, and even how your immune system works. Think of it as a small but mighty daily maintenance tool for your body. Let's go through 7 major consequences of stopping masturbating in later life. I'll explain what happens biologically, emotionally, and practically. 1. Decreased prostate health and urinary function. I had a patient in his early 70s, fit, sharp, who kept waking up 4 or 5 times a night to urinate. He had no idea that regular ejaculation, even solo, helps keep the prostate fluid moving. Without it, fluid can stagnate, leading to inflammation, swelling, and pressure that disrupts urination. You might notice a heavier bladder, a weaker stream, or discomfort that won't go away. Emotionally, it's exhausting. Sleepless nights, anxiety about leaving the house. Suddenly, your independence feels threatened. Practically, it might mean frequent bathroom breaks, disrupted routines, or even surgery down the line if ignored. Regular ejaculation flushes the prostate, reduces inflammation, and even lowers risk of prostate cancer. It's simple biology protecting your body. 2. Cognitive fog and reduced mental clarity. Another patient in his late 60s told me, "Doc, I just don't feel like myself anymore. I forget why I walk into rooms. My mind feels foggy." Here's the science. Sexual activity releases dopamine, serotonin, and oxytocin, chemicals that protect memory, focus, and emotion regulation. Stop masturbating for months or years, and those brain protective surges vanish. Emotionally, you feel less sharp, less capable, and maybe even less confident. Practically, it affects work, hobbies, and social life. One man quit his chess club because he couldn't concentrate. Another, a retired teacher, said he felt blank every morning. 3. Heightened depression and emotional numbness. I once treated a 72-year-old widower who said, "I don't feel anything anymore. Not sadness, not joy, just flat." Masturbation releases endorphins and oxytocin, your natural stress relief. Without it, emotional numbness can sneak in, evolving into depression. Emotionally, you feel disconnected. Practically, hobbies, social interactions, even sleep and appetite may suffer. And while therapy or medication can help, sometimes simply reconnecting with your own body can make a profound difference. 4. Poorer sleep quality. Another patient in his late 60s suffered from constant insomnia. Labs were fine, but his intimate life had long been forgotten. Orgasm triggers oxytocin, prolactin, and endorphins, chemicals that shift your nervous system from stress to rest. Missing this means fragmented sleep, fatigue, and a domino effect, weaker immunity, poor cognition, and higher risk of disease. Emotionally, fatigue can sap motivation. Practically, it affects independence, social interaction, and overall quality of life. 5. Weakened pelvic floor and circulation. I treated a retired firefighter complaining of urinary leakage and hip and back discomfort. His pelvic floor muscles, key for bladder and core support, had quietly weakened. Masturbation stimulates rhythmic pelvic floor contractions. Think of it as exercise for vital muscles. Without it, circulation slows, tissue elasticity drops, and nerve response fades. Emotionally, this can feel like your body is betraying you. Practically, urinary dribbling, difficulty standing, and sexual dysfunction can become daily struggles. 6. Weakened immune function. Sexual activity boosts IgA antibodies and reduces inflammation. Stop masturbating for months or years, and your immune system misses a natural defense boost. I saw patients who suddenly got sick more often, recovered slowly, or experienced flare-ups of chronic inflammation. This isn't just minor illness. It can affect long-term disease prevention and recovery. 7. Loss of body ownership and self-worth. Finally, neglecting self-intimacy can make you feel disconnected from your own body. One patient in his late 70s told me, "I feel like I'm just inhabiting my body, not living in it." Emotional and psychological distance forms when you stop caring for your physical self. Masturbation, even private, gentle, non-sexual self-touch, reminds your nervous system, "I matter. My body matters." Emotionally, it restores dignity. Practically, it encourages self-care, physical activity, and engagement with life. So what can you do starting today? Reintroduce self-touch safely and privately without guilt. Aim for consistency. Frequency isn't about obsession, it's about maintenance. Pay attention to pelvic floor muscles. Gentle kegels help support function. Pair intimate care with healthy lifestyle habits, sleep, nutrition, light exercise. Observe changes in mood, sleep, and energy. You'll notice small improvements quickly. I know this can feel awkward or even shameful, but it doesn't have to be. Reclaiming intimacy isn't about lust, it's about your health, your brain, your sleep, your dignity. Small steps today can restore energy, independence, and confidence. Age does not define your vitality. Remember, this isn't about going back to your 20s. It's about protecting your body and mind, feeling alive, and taking ownership of your health. If you found this helpful, like this video, subscribe, and share it with someone who might need to hear this. Comment below where you're watching from. Your story could inspire someone else. Age does not define your vitality. Small, consistent actions reclaim your comfort, freedom, and confidence. Start today. Your body, your mind, your life.